Now, Republican Congressman Michael Burgess of the state of Texas, a member of the House Energy and Commerce Committee and chairman of the Subcommittee on Health. Good morning, sir. Healthcare. We're going to talk about this. What is next? It is music to our ears when we hear about a group of 43 Democrats and Republicans working on this problem solvers group. Is there actually going to be problem solved here?
That's a good question, and I don't know the answer. I will say that early this year in the Energy and Commerce Subcommittee on Health, we actually opened up with bipartisan hearings. They were quickly jettisoned by people who simply wanted to criticize the Trump administration, so they didn't get very far. Perhaps there is a new day that has dawned because of what happened in the Senate. But I will just tell you this, and this is just me personally, not as the chairman of the subcommittee, not as a member of the Republican conference. The cost-sharing reduction issue came about because of an error in drafting the first Affordable Care Act. And those appropriations were being made, or those dollars were being made without appropriation, and that was illegal. The House sued the president. We were told we would never have standing to do so. We were given standing, and then we won at the district court level with the suit filed against the Obama administration. So this was kind of a big deal as far as House members asserting their Article 1, Article 2 authority over the White House.
I hear you, sir, but you saw the map. You probably didn't see it, but we put a map up.
No, I didn't see it.
You know, your state of Texas has one of the largest shares of Americans enrolled in Obamacare who gets cost-sharing reductions. So the legal standing aside, you guys get a lot of the money.
Why was it not done correctly in the first place? And then why, you know, Ali, when you look at just the raw dollars for the cost-sharing reduction for the entire country, it's about $8 billion for this year, not quite that amount for next year. If the entirety of the Affordable Care Act is teetering on the brink because of the want of $8 billion, with the number of billions of dollars, hundreds of billion dollars that are involved in this bill, it just begs the question, how stable is the program overall?
Well, no, that's got to do with
blame House Republicans
that's a multiplier
and blame
effect,
the president, but the issue is the law itself, correct?
Right. I don't think we're on the wrong side of the discussion about whether things should be done the right way or the wrong way, but the fact is it's a multiplier effect, right? It's not the $8 billion. It's all the insurance companies who aren't sure that the money is going to be paid, so they'll make decisions that have much greater impact than $8 billion about whether to stay in a county or a state or a region. So you would agree with me, as a doctor yourself, you would agree that the insurance companies depend on a certain amount of stability in the planning. So the issue as it stands today is whether or not those payments get made.
Instability has been there from day one, the way the law was drafted.
But there was no instability about the cost-sharing reduction.
And, sir, we can continue to go back and forth. It wasn't done right the first time. And this is a point we're at where we're going, let's improve it and fix it. Because, by the way, there was an opportunity to tear up how it was done the first time, but Republicans didn't take that opportunity.
Yeah, and therein is a shame. But anything going forward, in my opinion, and again, I'm just speaking for myself and not for my conference, but the individual mandate has to be on the table for any discussion that is involved going forward, especially as it involves the cost-sharing reduction. The individual mandate changes the whole relationship between the government and the governed. The individual mandate is that thing that makes Obamacare so coercive that it was never popular. That is where we should begin our work. That is what I would like to see from whatever discussions are going forward.
Let me ask you a question. Because you see
cost-sharing reductions bring us to that point, I would say, okay,
I just want to get beyond this, because and I appreciate that you come onto our show and we have this discussion, but let's move to the future. You're a doctor. You know much more about patients than Stephanie and I do, because you've seen them. You spent your life, you're a gynecologist. You spent your life talking to patients. Every other rich country in the world, 34 out of 35 rich countries except for the United States, have universal health coverage. 58 other countries have universal health coverage. They all have some version of a mandate, right? You know that. The concept of universal health coverage means everybody has to have it. If you look at Switzerland, which I think you would like, everybody has to have coverage, and yet it's all private insurance.
Look, in fact, over in the United States Senate, they had an option to vote on a single-payer system, and that was rejected by Democratic senators last Thursday night. So we can have that discussion as well if you would like. It doesn't get us very far towards solving the current problems. And Look, I will also tell you that during the Obama administration, I met with my legislative liaison on multiple occasions to try to fix some of the problems that were existent in the Affordable Care Act. I never got any traction with the administration. I will tell you I've gotten a lot more traction with the Trump administration. And
that could be, you know what, I have a theory on that one.
Solution.
You might be getting more traction with the Trump administration because you're a Republican and so is he.
Well, is that why I got no traction with the Obama administration?
Well, the Obama administration was blocked across the board by Republicans, was it not?
No. I invited the legislative liaisons in. We would have robust discussions about some of the things that we might do to fix some of the problems in the Affordable Care Act and Medicare and Medicaid. But none of those discussions ever bore fruit.
But it's a fair assumption, sir, that when your own team wins the election, you have a more friendly relationship than when the other team does.
Well, that's certainly what President Obama conveyed to Eric Cantor one day. Isn't that right?
Well, President Trump does call Democrats sick losers all the time.
Well, look, and I will think you will see that more Democrats have been down to the White House during the Trump administration than Republicans went down during the Obama administration. I think the Trump administration has actually been fairly open to some ideas. In fact, sometimes it's a little concerning how open they are, but they've certainly been willing to have the discussions. I don't think you can deny that.
Congressman, I'll give you this. I don't know if it's connected to you or not, but since you started talking, the Dow's back up above 22,000. So
there you go. The market likes you, sir. All right, we have to leave it there.
They should.
Thank you so much for joining us this morning. Thank you, Republican Congressman.